I'm Richard Elliot. I'm the Executive Director of the Canadian HIV/AIDS Legal Network.
Yeah, I'm Len Tooley. I'm the Community Health Promotion Coordinator at KD.
My name is Trevor Stratton. I am the coordinator for the International Indigenous Working Group on HIV and AIDS, which is hosted here in Canada by the Canadian Aboriginal AIDS Network.
So my name is Christian Hoy. I'm a HIV positive person, Asian gay man. I belong to the Global Network for People Living with HIV in North America, as well as affiliated with CTAC and ICAD.
So my name is Kwaku Adamako. I'm the manager of the African Black Diaspora Global Network on HIV and AIDS, which is ABDGN.
My name is Jean McDonald, and I'm the executive director at Maggie's, Toronto Sex Workers Action Project.
I'm Nikki Stein. I'm the executive director of the Teresa Group.
I'm Aidan Scheim. I'm doing my PhD at Western University in London. I think that there are the officially recognized capital K key populations, which I think is a useful framework, but I think of it more broadly. I mean, when I think about key populations, I think of populations that are particularly vulnerable to HIV and that have greater challenges accessing treatment and support because they're marginalized, criminalized, and stigmatized. And so I think that includes, in Canada particularly, African, Caribbean, and Black people, Indigenous people, men who have sex with men, sex workers, prisoners, and trans people. But I think that those groupings sometimes hinder us from seeing the interconnections and the fact that people who belong to more than one of those groups are usually the people who are most vulnerable or most marginalized or unaddressed within our response to HIV.
One of the key issues for sex workers in Canada, especially at this time, is the fact that for the first time in Canadian history, prostitution, sex work, will be in fact criminalized. In the past, a lot of things around sex work were criminalized, but the actual purchase of sexual services will now be criminalized. When sex work is criminalized, this really creates a lot of barriers for sex workers in terms of accessing HIV services, treatment, etc.
Well, one of the things that came out of the conference was the challenge in naming key populations. So, for instance, one of the goals that was set was this 90-90-90 goal. Right? So 90 people who are HIV positive know their status, or 90%. 90% of people are on treatment and 90% of people are undetectable. One of the questions that came up was who are the 10% of each of those categories that are left behind? And sometimes when we mention key populations, we can sort of minimize people's experiences into these identity boxes that don't necessarily fit their whole lived experience. So I'm not sure if I could successfully name a bunch of key populations and capture the complexity of HIV. But one thing that I can say is that people who feel that they are a key population are usually can be pretty good at naming themselves. So that's sort of how maybe we could go from here.
The big takeaway was that while there is a lot more discussion happening about human rights as an important part, a critical part of our response overall to the epidemic, that it's not fully integrated yet into the broader global discussion about what we need to be doing. There are a lot of decision makers, policy makers, the people that actually decide where the money gets allocated, who I think are still quite focused on just how do we get more people tested, how do we get more people access to antiretroviral drugs and other aspects of treatment, which obviously is hugely important. But unless we're going to talk about the human rights barriers that stand in the way of doing that, and unless we're going to talk about how we make sure people's human rights are protected in the course of connecting them to testing and to treatment, then we're ultimately going to be doing ourselves a disservice and we're going to be hindering the effectiveness of our response.
The big takeaway, I guess, because I was at the Global Village so much, so, just really having a community response. How do we get involved? How do we actually celebrate lives as persons living with HIV? how can we learn from one another, translate our knowledges, build relationships and dialogues. So I think the key message is really, translating those policies into reality that works for us. And it's not just, policymakers, deciding how funds are being distributed, but really engaging community people and from the ground up in addressing HIV.
So I'm sure people have talked about the flight disaster that occurred prior to the conference, and that really had a somber effect, I think, on the conference. But as a result of that, there was a lot more community mobilization that seemed to be happening. The first day of the conference, I was observing people who, at that time when they didn't really know who was on the plane, you would see these reunions happening in the hallways, people bursting into tears saying, like, thank God I didn't know if you were on that plane, because they knew they were coming from that route. And so I think when you start an international conference where people are already vulnerable and attuned to just like what really matters, these human connections and partnerships and relationships, it really set the tone for the rest of the conference.
I think there's a lot of really exciting progress and energy around biomedical prevention, particularly around PrEP, thinking about men who have sex with men and trans women in particular. And I think that's also tempered by recognition that all of the social conditions that are necessary partners to biomedical interventions are not where we need them to be. And so I think that there's a disconnect somewhat, but I think that there's growing realization of that disconnect and sort of energy to address it.
The more we hear, where we have sessions in the more scientific part of the conference that actually are given by people who are living with HIV and who are directly affected, the more meaningful it is. So we can marry the research and the lived experience.
A lot of the activities of these key populations are already criminalized. So the key populations are in a sense, marginalized in society already. And I think that it is a harm reduction approach that is the cure. That's the cure to HIV and AIDS, is harm reduction. These key populations are used to being chased around, used to being criminalized and trying to thrive in the shadows. And we need to bring them out into the open and have them be part of the circle. And that's the only way we can do it, is to address these reservoirs where HIV is hiding in Mother Earth's body, which is the key populations.
Thinking particularly about trans women in the work that I do around trans people, I think that there was a lot of discussion at the conference about the burden of HIV in trans women globally, but we actually don't have any good data about that in Canada, which is a huge problem. It's really hard to construct a response when you don't know, you don't have a handle on the scope of the issue, right? And so I think that including trans people in data collection in Canada is something that's relatively simple and a really important step. And slowly that's beginning to happen in some jurisdictions.
We should get our political leaders to actually commit to sound public health policy when it comes to HIV that is based on evidence and that is based on human rights. And both of those are in really short supply in Canada. And in particular, they are really in short supply at the federal level in terms of federal policy responding to HIV.
So in Canada, I would say that the HIV sector needs to continue to step up to fight for decriminalization and to support sex workers and sex worker-run organizations.
You know, what I did at the conference was I listened to the voices of the community and people who are living with and affected by HIV. So I think we should keep doing that and maybe do it better.